Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Bharat N. He's done MD Pediatrics and also done the fellowship in neonatology. Now he's working in Chinmaya Mission Hospital and he is a very popular pediatrician and also neonatologist. More than anything, he believes in not harming the children knowingly or unknowingly without knowing what to do, what not to do by the parents. So today he has come to tell the parents what to do, what not to do when there is a wax in the ear. So Bharat, please tell us what is this wax, what is the function and why people are worried about the wax.
Yes, thank you, madam. Thanks for the introduction. I thought we'll discuss something which is very commonly asked by parents today. So, which is one of the sense organs in our body, that is something related to ear. As we know, we have 5 sense organs. Ear is one important organ which has been divided into 3 things, that is external ear, middle ear and inner ear. Inner ear has very important role in hearing. For functioning of middle and inner ear, which is very important in hearing and balance, the external ear has to be functional and properly working as well. So this external ear is commonly faced by certain problems, something which usually seen in humans, that is production of wax. We call it as cerumen. Sometimes, not sometimes, I would like to start with majority, including even animals, we produce wax inside the ear. This wax, those which
what is the function of that wax?
Yes. So it usually forms a layer inside the external ear and it protects the skin. It protects against the bacterial invasion of the skin. And it also lubricates the skin. So it has an important function in our body. It is not produced simply because it has to be there. It has its own function. So it is not a problem. It has its own importance. So yes,
it has got a protective mechanism. So it is meant for protecting and preventing infection in the external ear.
Yes. So once produced inside, it is supposed to come out. Say for example, I usually tell parents that external ear length will be of elbow length. Say for example, if I have to see what is the length of my external ear, I have to compare it to my elbow.
And they should not have the probe, which is the stick, which is longer than this.
Yes.
Otherwise, they will go and poke in the eardrum.
My elbow is hardly 2 inch. So I should not use any instrument which is more than 2 inch, which will go inside the ear. So while cleaning, one has to be very careful about this. And this wax which is produced inside, it moves actually. It moves out and it comes out. So you don't have to do anything to make it come out of the ear.
Automatically it comes.
Automatically it comes. So once like while if you see this wax, especially while bathing, I advise the parents that when you are bathing kid, you can clean this whichever you see at the outside. You need not clean something from the inside.
Which is deep inside. Never try to remove from inside.
You need not put a torch. Try to clean it from inside. Whatever is visible on the outside, you have to clean with that. Basically with a towel, something sharp or something like a earbud should be avoided.
Should not be then.
Should not be.
So especially when they use the earbud, instead of removing, they're pushing it inside.
Exactly, madam. Ear canal is very small in kids. And there is a narrow neck as well in between the ear canal. So if you push an earbud, which is more than ear canal, you will be removing only this part of wax. Rather, inside part of wax, you will be pushing it. You will be impacting
towards the membrane. You are pushing it to the
towards the membrane. So if you push, this wax will get impacted, and this is what will create problem. So a cerumen or a wax which gets impacted will have usual symptoms. What are the usual symptoms? One, the common symptom is baby keeps rubbing the ear, keeps touching like that. It can cause pain. It can cause tinnitus, what we call it as ringing sensation inside the ear.
Yeah.
These, or sometimes hearing might get affected. If it is a very
Oh.
solid wax, it can
Oh.
affect hearing as well. So
And
these
that
are
is a very important thing for the learning disability. This is
yes,
one of the reasons.
yes.
Okay.
The baby might not respond to your you like okay, I'm whenever I'm calling, the baby is not responding properly.
Hmm.
Previously, baby was responding. Now the baby is not responding. Look at the ear. There will be
Hmm.
wax, impacted wax.
Hmm.
So that's how it will be. Impacted wax causes these problems.
Hmm.
So the common question from parent is like, how do I prevent it? And what do I do? What can I do at home?
Hmm.
And what do you advise? I mean, like, should I really come to a doctor for this? Is the usual question. Is it really a pediatrician who will handle, or is it a ENT surgeon?
ENT
Because
surgeon, yes.
ENT surgeon, ear, nose, and throat. So common like thing is like again, I have told already about the care. Yes, there are certain literature even outside India. Uh, they have used soda bicarb. So they use soda bicarb, dilute it to 5 times in water, like one fourth spoon of soda bicarb. They mix it with 4 spoons of water, and they use just drops to dissolve the ear.
Okay.
So that is being done. So should I use it? The recommendations have come down on that, especially on those home related practices. In India, it is common to pour mustard
They
oil.
put mustard oil and the heated coconut oil and also
Exactly.
the old oil, and that can introduce the fungal infection also.
Yes. Yes.
Yes.
So these are harmful. So certain harmful things has to be avoided. The other harmful thing is sometimes they do irrigation of water. They put water inside the ear using some syringe, which they would have seen online, and they try that. So sometimes you can injure the eardrum.
And not only that, suppose earlier by poking, if they have made a hole in that
Yeah.
eardrum,
Yeah.
this irrigation will take infection from exterior ear to the
To the
inner
eardrum.
ear. Yeah,
To the eardrum.
middle ear. Yeah.
In fact, you will harm. Either you know the procedure or you should avoid doing it, because especially in a kid, if it's an elder kid, then it can vocalize, it can talk. If it's a
But
smaller
small
kid,
children, they can't. Yes.
we should not take that risk.
Hmm.
Cleaning. What I usually have seen is they use
Hook-like thing. Hook-like
hook-like
thing.
thing,
Metal,
different
metal one.
metal hook-like thing to
And
clean.
in olden days, the men used to come for cleaning with all varieties of, tied like various keys. Yeah.
Yes, madam. Even I remember my mother cleaning that.
But still, she has cleaned well. Your ear hearing is very good.
So that has its own problems, because it can damage the skin or it can damage the tympanic membrane, which is
Yes.
inside the ear.
Yes.
So I would always refrain from doing that. What can be done? Yes, as I told, after bathing you can clean it, whichever visible you can clean it. Sometimes if I see during a healthy visit, I can use waxolytic agent. So waxolytic agent, usually I advise to put 5 drops. If at all, if I'm seeing wax inside this ear, I'll put the baby ear up facing towards the roof, and I use 5 drops inside, 2 to 5 drops inside this ear, and I allow it for 10 minutes and make the child sleep on the same side after some time, so that whatever this went inside, it will dissolve the wax and it will
come out.
come
Okay.
out. So
Okay.
that's how a waxolytic agent works. Usually I advise Solivax. That's how I advise parents to use.
Okay, okay. And the irrigation and removing by forceps or something should be done by the ENT surgeon and not by the parents.
By an
So,
expert,
yes,
definitely by an expert.
yes. So, thank you very much, Dr. Bharat, for telling that wax is a protective one and not to worry about it unnecessarily. And then, if at all it is problematic, put the waxolytic agent and remove it, and otherwise then go to the ENT surgeon. Only if there is a hearing problem, something, then only they should go. So
Yes.
thank you very much for so lucidly explaining to the parents what to do, what not to do. And thank you. I'm sure all our viewers now they know why they should not put the sticks inside their ears. And if at all they use, how much stick to put.
Yes.
And that is what you have told. Thank you very much.
Thank you. Thank you.